Welcome to the UK Made Easy podcast, where we help aspiring international medical graduates like yourself achieve their dreams of passing their PLAB 2 and practicing medicine in the UK. Hello and welcome to yet another episode of the UK Made Easy podcast. My name is Sif, and in this episode we're going to listen to a role play done by our own Dr. Nada, and the theme of this role play is tension headache. Now, as easy as this station might look like, but there are a few things that you need to take into consideration when it comes to these sort of scenarios. First and foremost would be to find out if the patient might have any signs or symptoms for other sinister reasons. So that's very important to take into consideration, and it's also important to distinguish between the different types of headache. And again, when it comes to ice, that's one of the things that we talked about previously in this podcast, but you need to you need to probe and find out if the patient might have any concerns whatsoever and how to address these concerns. Now, needless to say that tension headache might come because of lifestyle choices, so it's very important to investigate those as well and find out if there are things that we can do or that we can advise the patient to do so that they relieve the headache. Now, one of the things that Dr. Nada talks about is the difference between episodic headache and chronic headache as well, and it's very important to throw that in when you suspect that the headache is more on the chronic side. Now let's go on and listen to the recording, and I hope that you will be able to derive some value from the recording. Join the UK Made Easy online academy and put your hands on exclusive videos detailing over 300 PLAB 2 scenarios with easy to follow notes that contain the latest NHS guidelines. In addition, you get access to take part in our regular member-only group mocks where we put our heads together and discuss common pitfalls and challenges. Book your spot now at www.ukmadeeasy.net/courses. That is www.ukmadeeasy.net/courses.
Hello.
Hello?
I'm Dr. Gupta, one of the junior doctors in the clinic. Could you please confirm your name and age?
I'm Michelle, doctor. I'm 45.
Nice to meet you, Michelle.
Thank you.
How can I help you?
Doctor, I've been having this headache for a couple of days.
Could you describe them a little bit more for me?
I'm not sure. It's actually been on and off for the past 2 months, and it's really affecting my life now. I mean, I can't concentrate at all. I feel like I want to tie my head all the time. I don't know if it's getting to you. I don't know if you understand what I mean, but it's really annoying.
Yeah. No, I understand, Michelle. But I can assure you we'll sort out whatever it is by the end of this consultation. Yeah.
Thank you.
So you said you have been having this since last 2 months, and they come and go.
Yeah.
So is there anything in particular you remember might have started it? Did you injure yourself or anything?
No.
Okay. And is there any particular time of the day when these headaches are worse?
I feel like it's worse, or it starts after I come back from work. I don't know if it's related, but it does tend to happen at that time all the time.
Okay. And if you have to score the pain from 1 to 10, with 1 being the least pain and 10 being the worst, what would you say? What's the score?
I'd say around 6.
Okay, yeah, that's pretty bad.
And
have you tried anything to make it better?
Well, I'm off and on the paracetamol, but it doesn't go away, doctor. It keeps coming back. I mean,
and does anything make it worse? Yeah. And does anything make it worse?
No.
And again, coming back to the question, could you describe how this pain you might feel? Is it like a band type of pain?
Yeah, exactly. It does feel like a band. It's like my head is being squeezed.
Oh, okay. Yeah, I can understand that. And have you noticed any other symptoms?
Like what, doctor?
Like any problems with your vision?
No.
No, okay. And any vomiting?
No, doctor.
And does this headache, it just stays in your head, or is it going anywhere else also? Like in your neck or something?
No, it's just in my head.
Okay. Any problems like with your moving your neck stiffness, anything that you might have noticed?
No, doctor.
Any rash on your body?
No.
Okay. And just I wanted to ask you earlier, so these headaches which come and go, which you're saying, so how long do they last usually?
I'm not sure. It's just random. And sometimes it's just an hour, sometimes it goes on until I sleep.
Okay. And Michelle, you mentioned that it's something might you get them worse when you come back from the work. So is there something at work that you might have noticed recently might be stressing you out?
Not really, but I just got promoted. I'm actually happy about that. I'm not stressed. I mean,
Congratulations.
Yeah, thank you. It is a different environment, but I am happy.
Yeah.
I'm not stressed. I don't know.
But do you think that maybe the workload has become too much and
Yeah,
you haven't been
definitely.
able to get a
Yeah,
lot of
it's
sleep
way
or
more
something?
than
Yeah.
before. Yeah.
Yeah. Okay. So some very quick questions about your past medical conditions, Michelle. Have you been diagnosed with any medical condition previously?
No, doctor.
Or like you have these for since last 2 months? Have you consulted anybody else for these headaches?
No.
Oh, okay. And any allergies?
No, doctor.
Any regular medications that you might take?
No, just the paracetamol.
Okay, yeah, that's fine. And some questions about your lifestyle. Do you smoke, Michelle?
No, doctor.
Okay. And how about alcohol?
Well, yeah, especially the last period of time since I started the headaches. I've noticed it gets better when I drink wine. I don't know if that's right, but it does happen. It helps me.
So would you say that you have been drinking a little bit more to relieve these headaches? Is that what is happening?
Well, more than I usually do, but I'm aware of the regular amount I'm supposed to take, so it's just one
yeah,
can.
that's good. Yeah, that's good. Okay. And anybody in your family who had similar kinds of condition?
No, doctor.
Okay. Thank you for answering all these questions, Michelle. So what I will like to do is examine you, take your vitals and do a general physical examination. Yeah, and then examine your neck to see if there might be something.
Everything's normal.
Yeah, so Michelle, after what you have told me so far and after examining you, I think the most common possibility of this is something called tension headache. Have you heard about that?
Tension headache? No, doctor. What's that?
So, Michelle, like as you mentioned that you have been, although you're happy about your promotion, but that has made your life a bit stressful. So many people who go through this kind of stress develop these kind of headaches, wheezing types of headaches. So I feel that might be the reason why you're having them.
Because I got promoted?
No, that's not what I meant, Michelle. I'm really happy that you got promoted, but it's, the stress in your life that might have gone a little bit up and you might not be able to relax in your evening times. So research shows that can actually lead to these kinds of headaches.
Are you sure, doctor? Because my neighbor, she had similar headaches and she did something called a CT. That's actually what I want to do. It turned out she had a tumor. I mean, oh my god. So I really got worried. Can I perform a CT as well?
I'm sorry to hear about that, Michelle. And I can understand your concern. But Michelle, from what you have told me so far, I don't see any symptoms of these which might make me suspicious of a tumor. Like people with tumor usually have headaches all the time, and that's more common in the morning. And they also have feelings of vomiting, and they might feel some weakness in the limbs. You haven't got any of those symptoms, isn't it?
But my neighbor only had a headache, and that's what it turned out to be. I just want to be sure, doctor. I'm a bit worried.
No, I understand your concern, Michelle. But doing CT scan when it's not indicated is also not good. It involves giving patient radiation, which can do harm in long term.
Then why do I get them so frequently, doctor?
So as I was mentioning, it can be more related to the stress in your life, and if we can work on that, I am pretty sure you can get rid of these headaches. Would you like to talk about that?
Okay. Moment, but let's talk about the tension headache one first. Do you have any concerns about that one in particular, or should we just skip to the feedback?
I think I should have asked already from the patient that what was she concerned about, because if that CT scan was her main concern, then probably I could have devoted more time on the management.
Yeah, exactly. Yes, exactly. That was your only problem, actually. Otherwise, you were really, really good. Let me show you your evaluation right here. 1 second.
Okay.
So this is
Like
your evaluation.
us.
Yeah. Okay. So right here you have data gathering, and then you have the management right here, and then IPS is down here. Okay. So basically all green means that you are really good at this. The only problem was down here because you didn't really finish in time, so you didn't get to the management part, but we're going to talk about it. It's really easy, and I'm sure you know it already. So first of all, the data gathering. You were perfect. Everything was perfect. You just missed out on asking about fever because that's very basic. I know you know it, but you missed it, so just take care of that. And of course, GCA. So make sure you ask about pain in the eyes, jaw pain, pain while combing. This is a very, very standard thing to exclude, okay? Just make sure you don't miss that. And one little tip right here is to ask about recreational drugs in the lifestyle, because sometimes it's just the reason, right? So you want to make sure you exclude that as well, okay?
Otherwise, I kind of actually on purpose excluded that this time, because that's like, you see, this is a rote learning for us and we have already crammed all of these things. So this already is there. Smoking, alcohol, recreational drugs, that's how you go. But I was trying to eliminate that on purpose in all my today's history. Like if it didn't make sense to where the diagnosis was going, I was trying to eliminate it.
Yeah, so because it was on
purpose. That is where my time management goes really bad.
Yeah, exactly. That's really smart of you, actually. It's not that important. I just wanted to tell you. So if you have time, if that comes to you in the exam, because this comes in two ways. It could come as a tension headache, or it could come as a migraine. Both ways, they're just going to differ in the symptoms. And then she's a demanding patient at the end, and she wants a CT. Okay. So either way it comes. If you do have time, try to exclude the recreational drugs. Otherwise, you can just skip it, just like you did. Okay. So that's that part. Now for management. You started off really well. You talked about what a tension headache is. You told me that it's probably because of my work and my promotion and my stress. I'm just going to tell you a better way to say it, just to make sure that you don't waste a lot of time, because this patient will keep talking unless you're very convincing. Okay? Okay. So I'm going to tell you how to do that in a moment. Now let's talk about the management. Of course, you know this. There's no need for admission at all. There's no need for CT because it's irradiation. You told me about that, so thank you. And there are relaxation techniques you want to tell her about. You want to tell her she can do yoga, massage, a cool flannel. She can drink more water. Painkillers over the counter only, and tell her not to overuse them, because take care of this area. Because some people, when she tells them about the paracetamol, and she tells them it doesn't work, or it comes back even after paracetamol, they go on through the pain ladder and they give her maybe cocodamol. Now that's wrong, because this is not indicated. It's not a pain that needs a higher painkiller. It's just a pain that has a cause that is not eliminated. Once the cause is eliminated, it's gone, right? So you don't need a higher painkiller. You just need general advice. Okay? Now for the IPS, let me show you right here. Now there are 5 little tricks that I basically put together to go through the station. You got through 2, you used 2. The one you used is, you used her words. You told her, you said you got promoted. That's why it's because of stress. And some people tend to have that because of stress. That's very good. You also used the part with the radiation. So that's another thing. Now the other 3, I'm going to tell you about them now. Let me tell you how this scenario might go. Let's start with the diagnosis from the beginning. So if you're trying to tell her the diagnosis from the beginning, this is how it should go. So tell her, so Michelle, you told me that you had a band-like headache, or you felt like you want to tie your head, right? And it's not the first time, and it usually comes and goes basically when you come from work, right? She's going to tell you yes. So here you're just putting a ground basis that you're going to tell her it's probably because of your work. So you're using her words, right? Okay? Then tell her, okay, so from our assessment, you seem to be having what's called a tension headache. Have you heard of that before? No, doctor, what's that? You're going to say it's also known as a stress headache. You told me that you get this roughly 2 to 3 times per week, right? Now, this is called an episodic headache, okay? Now, here you're going to seem a bit more knowledgeable, and she's going to get convinced because you're going to seem trustworthy, right? This is something not many people know. An episodic headache is when a tension headache occurs less than 15 days per month. If it's more than 15 days per month, it's chronic. So if you use that tip, it just gives an impression that you are trustworthy, okay? So it's going to help with your image. That's one of the tricks. Then if she keeps saying, but doctor, why am I getting this headache so frequently? Here you're going to tell her about the triggers. Now, there are many triggers for tension headache, and you told me that you just got promoted, and that's very good, but it must be hard to keep up with the new workload, right? She's going to tell you yes. Here you did that part. Now, what if she answers and tells you, no, but doctor, I'm very happy about my promotion. I don't think it's the problem, because sometimes she does that. Here, you're going to tell her about the other triggers. Tell her, this could be there. That's one reason, but it could also be triggered by anxiety, dehydration, missing a meal, loud noises, and so on. Okay, so always have an answer in your pocket. Okay? Now here, she'll probably keep telling you, doctor, I'm still worried. I read on the internet that a headache is a sign of brain tumors, or my neighbor had a brain tumor, whatever she says. Here, as you did, you weren't too blunt. You let her down gently. You were as convincing as possible. But tell her, I can see where you're coming from. This is actually a very valid concern. You're right, that is one of the signs. So validate her concern first. But this type of headache has certain characteristics that fortunately don't apply to your case. There are also other signs along with the headache that would make us suspect serious conditions like tumors, but we have nothing to worry about here. Okay, so if you're convincing from the beginning, she's not going to talk further, okay?
Okay.
And then, of course, the part about the radiation, you already know that. And then at the very end, you want to tell her, after everything you've discussed, now how about I tell you about a couple of things that we can do to relieve your headache, and if they don't work, we can look into the option of the CT. So keep the door slightly open. And here you're going to tell her, you're going to tell her all the relaxation techniques and the over-counter drugs and all of that, okay?
Yeah. Makes
okay.
sense.
So that's basically the best way to approach a station like that. Do you have any questions about that one?
No.
Okay, perfect. Okay,